The Children's Health Fund is a national network of pediatricians with the goal of finding and treating the most vulnerable children in this country. In 2005, the city flooded here in New Orleans after Hurricane Katrina, and the members of this national network responded, bringing mobile clinics and mobile teams to the Gulf South to try and help find the children that needed help after the flooding. It became clear really early on that the New Orleans area had long-standing need that predated the flood. In response, the Children's Health Fund decided to start 2 new programs in Louisiana, one in Baton Rouge and one here in New Orleans. As a member of this national network, we were given mobile clinics, both for Baton Rouge and for New Orleans, and a team of case managers, physicians, and other personnel to help find and treat the children in need. Initially, there was a significant need for urgent care in the city, and so that was the main focus of our program, the New Orleans Children's Health Project. After the urgent care needs were met, the program adapted to become a medical home, using this model of healthcare delivery to provide comprehensive care to children. As the clinics of the city were rebuilt, we adapted our program again, this time focusing in on children with chronic medical conditions that are the children that really suffer the most when they fall through the cracks of the traditional medical infrastructure. We used a variety of strategies, including hotspotting, to find high-risk clusters of kids in schools that we could bring our mobile clinic and our mobile teams to in order to not only identify which kids were at elevated risk for death from asthma, but also to provide comprehensive care, including lung function testing, allergy testing, food allergy evaluations, etc. It soon became apparent, however, that a new need was growing in the greater New Orleans area. We were seeing increasing numbers of kids that spoke Spanish as their primary language, and we hired Carlos Naranjo as our case manager and medical interpreter to help us see these kids. In general, these kids were able to breathe just fine, and in the differential for shortness of breath in children, the next most common problem after asthma is panic disorder and anxiety. So I would ask questions along those lines, and that's when it became clear that the children who were coming were not simply members of families seeking better economic opportunities in this country, but rather they were refugees fleeing violence in Central America. This led to another major transformation in the care that we provided through the New Orleans Children's Health Project. We reallocated a lot of our money really to find these kids and locate them and provide comprehensive care to them. Many of these children had never seen a physician before. Many of the children were specifically targeted because they had chronic medical conditions, and that's why their families fled with them to North America, to the United States. We slowly spread out the locations that we saw these children in, including Kenner and the West Bank, throughout the greater New Orleans area. Over time, we've seen such a dramatic increase in numbers of kids needing to be seen that we knew that we needed to be more effective partners, and we began to collaborate extensively with federally qualified healthcare centers in the greater New Orleans area, where we could bring the expertise of our teams to these fixed-site clinics. And that is now the bulk of the work that we do is partnered with these federally qualified healthcare centers to provide comprehensive care to the children in these clinics.
Many of the children who we see in our clinic come to the United States as unaccompanied refugee children. Essentially what this means is that they're fleeing their homelands in Central America, fleeing violent conditions that are not suitable for the life of a child, navigating their way through multiple countries, facing many dangers, many trauma exposures en route, essentially to come here and to live a life that is not in danger and to be reunited with their parents. Many of the children we've seen, even over the last week, for example, in our clinics, meet this definition. For example, we had a 7-year-old come to our clinic the other day who told us about his experience navigating through multiple countries, basically trying to find his mom, who was here in New Orleans. Upon coming to our clinic, it's our job to make sure we comprehensively treat these patients. We screened him, for example, for any developmental, medical conditions, trauma exposure, mental health conditions. We talked to the families about their mental health needs, about their educational needs, linking them with an attorney, and essentially providing a medical home or a comprehensive center of care where they can come to and have culturally competent, compassionate care from our team members.